We're back. So just to remind you, releaseology is the practice and study of releasing muscles from spasm. And the basic idea is muscles in spasm pinch nerves and they pinch endocrine glands. So what is upper back pain caused by, or what is back pain caused by, or pain anywhere? Pain is caused by muscles that are tensing up and compressing nerves in the way. So between every vertebra that make up the vertebral column, you have nerves coming out. They're called spinal nerves, and the nerves are actually numbered, just like the vertebra themselves. And if any of the vertebrae are moved out of alignment, a lot of times because the nerves exit right between the vertebrae, there's like tunnels between the vertebrae, one on each side that the spinal nerves come out of, and half of those tunnels are made up by the vertebra above, and by the lower part of the tunnel is made by the vertebra below. For in between each vertebra, each intervertebral joint. So if any vertebra is moved out of alignment, that foramen, or that hole, that the half hole that the nerve comes out of, it gets trapped. So the nerve will get pinched and it will cause pain. So any muscle attached to the vertebra can pull vertebra out of place and thereby pinch nerves, the spinal nerves, and cause pain. So the trapezius is the most surface muscle on the back. It's right on the right under the skin. It's a huge muscle, one of the largest in the body. The origin is massive. It attaches to every spinous process from all the way from the very bottom of the rib cage. So T12, T11, T10, T9, all the T's, all the way up to T1. And then there's a ligament in the back of the neck called ligamentum nucha. It comes from that. And it also comes from the head. So that's a huge origin. And all those fibers all converge. They all confluence down on the scapula, the lateral part of the scapula. Comes kind of over the top inside corner of the scapula, and then all the way out to the acromion. And the trapezius, it actually inserts onto the spine of the scapula, just to give you the technical terms. And it's about the outside half, the lateral half of the spine of the scapula, and the insertion is onto the clavicle as well. So the upper part of the trapezius pulls the clavicle and the scapula up, and it rotates the scapula. The scapula we're looking at would rotate to clockwise if the right one was to contract. And the lower part actually depresses the scapula. So it all is about the scapula. So to release the trapezius, you have to stretch that scapula away from the spine and brace the spine so it doesn't wobble too much or whatever, and try to do pressure point release. So think of it in three sections: upper, middle, and lower. So I'm going to do the upper section, which actually attaches to the head itself, right to the back of the head. This, by the way, is the muscle that attaches to the very furthest back section of the occipital bone. So it can actually be related to headaches, but definitely is cause of mid-back pain and of a bending of the spine, you can imagine, if this muscle contracts. So this is how you release it. You hold the stretch, focus energy into the point, and slowly back your pressure out when you feel like you can get a release to trigger a release, and release that upper section of the trapezius. Let's see if I can demonstrate it a little bit better here. It looks a little bit better. I'm actually going more towards the middle of the trapezius right now. See, I'm stretching the scapula out away from the spine and doing pressure points with the ridges of both hands, the finger ridges of both hands. Now I'm mobilizing just to see which parts of it are tight. See, it feels like it's tight in that section there, that middle section, and also in the lower section. The lower section forms kind of a tail as it attaches to the spinous process of all the vertebra. So let's stretch the lower section up towards the scapula. I'm actually stretching the trapezius right now. So it's a huge muscle, isn't it? And the nerves that go to the trapezius, by the way, come out of the, they're like the nerves I was telling you about that come out of the spinal cord, the spinal nerves. And so if the trapezius is tight, it actually pinches its own nerve routes. So yeah, you definitely want to try to release the trapezius in three sections: the upper, middle, and lower. And with each section, it's a really wide muscle, so it's not like the small single finger pressure point release like you normally do. You can use the whole, like all of the tips of your fingers is like a phalanx or like a finger ridge, and you get releases across all the fingers, like all at once, like a big pressure point release. So looks like it's starting to let go. Looks like there's still some fibers between the lower and the middle part that are still tight to me. So I'm going to go back in and get a little bit more here. See, I can also see that her vertebra were all of them were kind of bending, like from the head all the way down to T12. There's a little bit of a bow when I started, and now it looks like it's straightening out. The lower section of her trapezius is definitely still tight. So what I'm doing now is I'm like kind of just hooking into the meat of the trapezius muscle and sliding it across the ribs up towards the scapula. This feels really good, by the way, and I can feel the muscle fiber stretching away from its origin. And I got to release. Years ago, I was given $500 if I could get rid of someone's pain that they had between their shoulder blades. A massage therapist that I knew had spent quite a few sessions doing work on releasing her rhomboids, the client's rhomboids, and to no avail, the pain kept on coming back. So I showed up and immediately realized that the rotator cuff muscles, especially this infraspinatus muscle, were in spasm. So pay attention, because if you can release this infraspinatus muscle, it'll actually release pain between the shoulder blades. I know it doesn't necessarily make sense, but if someone has pain there and you release this muscle, they will report to you that they feel better actually between their shoulder blades as well. So this just sort of releases rotation in the humerus and the reflex that the rhomboids and so on have with it when it's tight. So the infraspinatus, what it does is it's a lateral rotator. So like if you're at a backhand someone, this is the muscle that contracts. And I wouldn't recommend doing that though. And what you do is you want to stretch it. So it spans across to the back of the humerus. And so if the arm's open like that, you're basically stretching it. And I'm feeling around just to palpate exactly where the tightest fibers are. Her infraspinatus actually is pretty tight. You can see right under the spine of the scapula, which it's named after. It's not named after the regular spine in the back. It's the spine of the scapula, which is the ridge that kind of defines the top of the scapula. So I'm slowly increasing my pressure. This is called yang. Focusing into the point, making it more and more focused, and more and more intense a little bit. This one hurts too, so you have to be careful to not make someone jump off the table. This one can be really painful, but if you're very careful and you don't slip or wobble, it'll be okay. You definitely cannot wobble, and do not go back and forth across these fibers. You have to hold this pressure really steady. Use your stance and draw your pressure back to trigger yin, and let the energy flow through you. If you do it just right, you'll feel the point just really relax, and you'll feel energy go to the ground. So let's let's show you its buddy. This is called the teres minor. This is the other muscle that does lateral rotation. So the backhand movement of the humerus when it rotates out. This is the other muscle that does that. So there are two lateral rotator muscles, the teres minor and the infraspinatus. So the mechanics are the same for the release. You basically just stretch the arm open. You turn the hand as if you're going to take it under the body, or you internally rotate the humerus while you're doing it. So you see I'm holding the stretch of the arm with my palms while I'm also pressing it with my fingertips. Now this is a way of making your fingertips really strong. If you place the fingertips, the phalanx formation of fingertips on one hand over the other, the way I'm demonstrating, that will give you a really strong pressure point. So what I'm doing is I'm going back and forth just to make sure I'm on the right fibers. I'm not using pressure and grinding across it. I'm just actually moving the muscle with my fingertips. So after locating exactly the tightest fibers in this teres minor muscle, I'm slowly starting to increase my pressure. After increasing my pressure for a while, I feel like it might melt, and the teres minor is starting to give me a signal that it might relax. And as it does, I'll start backing my pressure out slowly, making it feel like I'm backing out, even though I don't really go anywhere. And look, see, it took quite a while before it released, but I got it to go at the end there. This muscle really illustrates how no muscle is alone. See, that last muscle we worked on, the infraspinatus, it forms a muscle chain with this rhomboid minor. People say, oh, I have rhomboid pain. So this is the area that they're referring to, because they've probably seen that name in a book somewhere. And the muscle we just worked on, the infraspinatus, remember, is actually the key to release, because it's part of this chain with the rhomboid. And if it's tight, then the rhomboid minor won't let go. But you also have to release the rhomboid minor sometimes. And the rhomboid minor does not attach to the ribs. It attaches to the top corner of the scapula, just under the levator scapulae muscle. And see, I have to stretch the muscle, or the actual whole scapula, down away from the vertebral column. The rhomboid minor attaches to the bottom cervical vertebra and the top thoracic vertebra on one side, and then it goes down to that angle of the scapula. So you stretch it down and away, hold the release, increase your pressure slowly, and until you feel like it can release, and then you start triggering the yin flow by slowly backing your pressure out. Let me show you again. So yang, so slowly pressure in, building your pressure, focusing more and more, holding that stretch, and when you feel that stretch, you'll feel the release because you start backing your pressure out, make it feel like you're backing out even though you don't go anywhere. Trigger the release and you'll feel that whole scapula drift away from the spine on its own. It just kind of melts. So, the muscle will feel like it's deflating. Also, when you do these releases, a lot of times you really do feel, you feel sort of like an energy pathway opening in your body. And I actually think it's a flow of electrons that comes from tight muscles, because I definitely really feel a flow of something. You can't see it, but you feel it. And when I feel it, that's when the muscles relax. When I don't feel it, the muscles aren't relaxing. Here's a rhomboid minor, or major. The rhomboid major is the counterpart to the rhomboid minor. It's a little bit lower, so it just says it's called major because it's bigger. And it attaches to T2, 3, 4, 5 at the spinous process, and the fibers drop at a 45-degree angle, descending to the, all the way to the bottom angle of the scapula, the inferior angle of the scapula, and that whole medial border of the scapula, that's actually the attachment. So you see where my thumbs are getting into the medial border, and I'm stretching the rhomboid major, and just holding that stretch without letting it go, and increasing my pressure into my thumb tips. You make it more and more intense. You really have to get this part right. And then when you back your pressure out, after you've been doing, slowly intensifying your pressure, you back your pressure out slowly and make it feel like you're backing out, even though you don't really go anywhere for, like 10, 20 seconds up to a minute. And keep repeating that process all along that ridge until you feel the entire rhomboid major release more. And when that happens, you'll actually see the scapula can drift, further away from the spine, and it'll help actually relieve rhomboid pain. But like I said, you really have to release that infraspinatus and teres minor also in order to release pain in this area, or it just comes back. So let's. So we've been looking at the rhomboid muscles, but the rhomboid muscles bring the scapula in towards the spine. Now let's go deeper. You can see this model's rhomboids are relaxed. I can easily slide my hand into the space of the rhomboid because it's super relaxed. But what I'm feeling is I'm feeling the fibers of the next layer of muscle down, which goes from the spinous process down to the ribs. It covers 4 ribs, 2, 3, 4, 2, 3, 4, and 5, and it actually comes from C7, T1, T2, T3. That's the serratus posterior superior muscle. So this muscle, it attaches to the rib. So what you want to do is you actually have to feel like you're depressing the ribs, like stretching the ribs, like bucket handles, down, like levers down from the vertebrae. You have to actually feel the movement in their joints when you're kind of bouncing it and stretching the serratus posterior superior. And when you feel like you've got that muscle in a stretched position, you hold the pressure, slowly intensify your pressure in yang mode, and check each of the 4 vertebrae it attaches to. Now this muscle spans across the erector spinae muscles. So it's definitely beneath the rhomboids, which are beneath the trapezius. You see how we're really like kind of peeling back the layers. But once you get it to release, it actually releases the erector spinae, which travel under it. So it's so important to release the serratus posterior superior. And not only does it release the erector spinae, but this is the main muscle that is like right behind the heart, and the nerves that go to the lungs and the heart. Well, yeah, the heart is the main thing I'm worried about with this area. So I just noticed that people that have heart conditions a lot of time, or heart issues, a lot of times these muscles get really tight, and when you release these muscles, It just seems to calm the heart and soothe the function of the heart. Probably because this is where the nerves are that go to the heart. There's also the vagus nerve that goes to the heart, but and that's the main one. But when you need your heart to kick in to do sympathetic mode, to kind of get stuff done and be sort of the more active mode that the heart runs in, you need these nerves to work. And if this serratus posterior superior muscle is tight, it actually really rotates the vertebra and kind of twist the ribs right behind the nerves that come out to the heart. So it's always concerning. And this is how you release it. So remember, you stretch the ribs down and away. Hold your pressure in those pressure points, for a good 20 seconds or maybe a minute, building your intensity, and then slowly back your pressure out, making it feel like you're backing your pressure out, but you don't go anywhere for about a minute. Trigger the release, and you'll feel those fibers relax. There's only 4 little pieces of this muscle on each side, but it's important to get all of them. And once you release the serratus posterior superior, you'll notice that it lets go of the erector spinae, which are trying to travel up and get to the head. But if this muscle is tight, it actually pinches all those nerves, and the erector spinae can't move freely. So, people have a hunched over neck. This is it. This is the cause of kind of that hunched over neck look. So you actually have to get that serratus posterior superior muscle to release before you can get the erector spinae or the semispinalis or the paraspinalis to release. So first, let's go through the spinalis cervicis muscle. It's a really short little muscle that attaches to the cervical vertebra. And this muscle, it's named after its attachments to the actual spinous process. So you have to get in there really close. You can find it, it's like it's thinner than a shoestring, the little fibers of it. But if a single vertebrae, is moved out of place, out of the vertebrae it attaches to, it'll, it's like a piano key getting stuck. Like you'll notice like just that one vertebra is out of position. When the larger muscles are tight, you see all the vertebra or ribs are, moving about the same amount, even though they might be really distorted. They're all, you can see an even line in the movement of larger parts of the body. But when you see a single vertebra that's one way or the other, through the neck here, it's probably because of either the erector spinae that's actually bending like longer sections of the vertebra, and then when we get down to the paraspinals at the very end, that's individual vertebra that are moving, and it's because of the small muscle. So this one, actually, this is a very long muscle. This is a longissimus, and longissimus thoracis. It attaches to all the thoracic vertebra. It's a huge muscle, one of the biggest in the back anyway. Notice most of the muscles in the body are actually in the front. And anyway, the idea with any muscle is always to stretch it. Stretch it. The stretch is towards the head. In this one, I'm trying to find a really good pressure point to lock into. So I'm finding it, increasing my pressure now. I'm bracing with that lower hand. So it's sort of like when you're ironing clothes and you're like stretching the fabric out. So I'm pushing from the ground into my fingertips to like really stab into that muscle. So I'm actually tractioning towards the head, but just so I have a really good hold and depth with my fingertips. And pushing from the ground, I have like a slight angle heading towards her feet. But you see, as I release, I'm using kind of leverage and like actually tractioning her neck and her spine out at the very end of that movement. And this muscle has several attachments. So I start at the attachments that are closest to C7, or like the middle of the rib cage, and kind of work each band of fibers, one vertebra attachment at a time, all the way to the top. So let's do the same thing with this iliocostalis. The iliocostalis, okay, so the spinal muscles are named spinalis, longissimus, iliocostalis. The iliocostalis is the furthest out. It attaches the actual muscle chain itself comes from the ilium, and it goes all the way up to the cervical, or the ribs is where it mainly attaches, and up to the cervical vertebrae at the top. But costalis is like the Spanish word costillas, so it means it attaches to the ribs. And that's mainly what it does, is it comes from the ilium, and it extends the rib cage back, as if you're to lift your rib cage up, if you're to look up, like she kind of did just a second ago. I could actually feel that muscle contract when she did that movement. So I noticed I actually kind of readjusted there. And I'm going to go in with a little bit more pressure, and see I'm tractioning the whole rib cage with the other hand, and really nailing the middle of that muscle as much as I can. It's just, the muscle's kind of like peeking up like mounting up, and I just kind of flatten it back out with pressure and the traction at the same time. It's the same thing. You slowly increase your pressure, build your pressure until you feel like the muscle might melt, and when you feel like it's going to melt, you slowly back your pressure out until it relaxes. Okay, so let's try it for the iliocostalis cervicis. This is that same iliocostalis chain, which starts down at the ilium, the hip bone, and works its way across the ribs in a line all the way up to the neck, the cervical vertebra, and so I'm going to show you just the part up at the neck. So remember, just press on muscles, don't press on cartilage and bones and stuff, don't push on nerves, don't cause too much pain, and go ahead and feel around, and what you do is you try to find the cervical vertebra and feel the muscles that run up from the ribs along the back, not the side of the neck, but the back of the cervical vertebra. You'll feel fibers of muscles that come from the ribs. That's the iliocostalis cervicis. So slowly increase your pressure after you've found good points in those muscles. Traction in the neck. As long as you traction the neck, you're okay. You can't really hurt the neck as long as you have good traction on it. If you have rotation, that's a problem. So just straight traction. Slowly increase your pressure. You feel the stretch build up. You're sort of bracing with your other hand to keep your balance. And I'm using my thumb there as a trick I use to balance my hand. See, I'm actually putting my thumb on my finger of my other hand. It really gives me a lot of balance. And I can step it through each vertebra one at a time by doing that. It gives me a lot of control. So I'm bracing the lower part, going into that semispinalis cervicis, or iliocostalis cervicis, I'm so sorry, and stretching up towards the head. So tractioning that muscle, tractioning the cervical vertebra, and releasing. Now let's do the semispinalis. So this is the semispinalis cervicis. Remember, the semispinalis cervicis and the semispinalis capitis are the main muscles that are involved with causing vertigo. But that's really in my head, neck, and face course. But you have to be able to release the semispinalis cervicis and semispinalis capitis to release pain in the upper back of the neck and in the upper back. And we're talking about upper back pain in this section, so I got to show you how to do this. What am I doing? I'm holding her head with one hand, and I'm trying to do a pressure point on her occipital bone. So really what I'm trying to do on this one is the semispinalis capitis. But I go back and forth between the capitis and the cervicis a little bit on this demonstration. Okay, now I'm getting into the cervicis with my middle finger. It's hard to see, my index finger's kind of covering it. Let me show you from another angle. And in this prone position. It's a slightly different technique with the person lying prone, but with a good face cradle so they can breathe, this is a great way to do it. What I'm doing right now is I'm kind of palming her head, not palming, but using my fingers to give her head a little bit of traction, tractioning her neck. That's the semispinalis there, and going into the attachment of the semispinalis capitis with my finger, doing pressure point release while I'm tractioning. So what you do is you slowly increase your pressure into the tight parts of that muscle with some traction. Use a good martial arts stance, push through your body into your finger, pushing from the ground. And hold the pressure steady, and slowly back your pressure out each time you want to do a release. When you slowly back your pressure out, let it slowly back out over about a minute, maybe 2 minutes, and try to trigger the release. When you trigger a release, you'll just feel the muscles start melting, and you feel like there's an energy flow going through your body at the same time that the muscle's just relaxing. And you start to get in control where you can just tell it, hey, release, and it does. So let's show you the semispinalis cervicis a little bit better from the supine position again. So this is more focused on the semispinalis cervicis. What we just showed you, by the way, was the semispinalis capitis for the most part, but I just mentioned that I touched the semispinalis cervicis. So this is the semispinalis cervicis from the back. And see all the vertebra the muscle attaches to. It attaches to the ribs, and that each of those bands can move individually. So just one of them can move and rotate a vertebra over, and either that or lifting a rib. So you have to check each one of them and do the releases really deep down. This is a muscle that's definitely attributed to vertigo, in my opinion, by the way. I've had just the correlation of many clients that had vertigo, and I released this muscle along with the semispinalis capitis, and guess what? Vertigo has gone away. That's because there's a nerve called the vestibulocochlear nerve that travels between the atlas and the head. Anyway, here's the semispinalis thoracis. So it's on that same deep chain of muscles, and when I say chain, it's just they're all in the same layer, and they do kind of contract together, but like I said, they can individually contract also. So this is just a lower section in the thoracic spine, and when one of these are tight, these are the muscles that are notorious for causing rotation and weird distortions of the thoracic vertebra, because they're strong and a little bit stronger than the smaller paraspinals, and when they lock, they really lock, and they will just pull the spinous process, which looks like the tail of a vertebra, over to one side or the other, and that rotates the whole vertebra. So it can, just one of these when they're in spasm, they can crimp the whole vertebral column like a bicycle chain. So let's go ahead, and I found a couple fibers here I want to get into. So I'm going to slowly increase my pressure, tractioning the spine while I do these release techniques, and slowly increasing my pressure, making it really kind of focused and just intense right in that spot, and then slowly backing my pressure out. And as I back my pressure out, I feel like it relaxes under my touch. So actually I'm still kind of increasing my pressure now, sorry. So this is the yang cycle. Slowly increasing my pressure, pushing from the ground. And now I'm making it feel like I'm backing out. Slowly backing out. There we go. We got some little release. Now see, I went straight down to the next band below the one I was working on, or maybe like 2 or 3 down. But this is still in the semispinalis thoracis. Do you feel the energy flowing through your body when you do these? When you not when you first press in, that's coming from the ground, focusing, pressing into your fingertip, stabilizing, making it really kind of intense. And here people really like a lot of pressure, by the way. It's one area where people almost always will tell you, hey, you can press harder. So anyway, let's do the last layer of muscle. So we've basically worked through from the most superficial layer of muscle, which are this is the trapezius muscle. There's one on each side, so the trapezius muscles. And after that was what? We worked on the rotator cuff, which are the infraspinatus muscle and the teres minor. And then what? Then we worked on the rhomboids, the rhomboid major and rhomboid minor. I guess we did the minor first. And then the serratus posterior superior. Beneath the serratus posterior superior were the spinal muscles, so the spinalis, the longissimus, the iliocostalis. Well, that's a lot of stuff, huh? And now we did the serratus posterior superior. Oh, I just said that. And we're working on the paraspinals. And the paraspinals are beneath the semispinalis. So we're on the very last layer. And what I'm doing is I'm showing you really fine manipulations. I'm going down in between just the single vertebra, down in that channel where I'm actually feeling the transverse process and the spinous process of each vertebrae that I'm checking out. And I'm searching for the paraspinal muscles, which are the individual muscles that really like shoestrings that go between adjacent vertebra, between the spinous process and transverse process. And I'm checking to see if any of them are tight. And as I go through, I'm finding quite a few of them, and I'm stretching them, doing the yang-yen release. And when I get the releases, I'm feeling the vertebral column just kind of say, I can relax, And slowly but surely, when you do all these, the vertebral column becomes a lot more aligned. So remember, bones don't move themselves out of place, by the way. Just popping them, back in place isn't going to do anything. And a lot of times, if these little muscles are tight, they can't stretch very much. So if I hate to say it, but when people get a quick adjustment of vertebra, and if these paraspinals don't want to stretch more than like 1 millimeter or 2 millimeters, you're going to end up tearing these little muscles. And when you tear paraspinal muscles, guess what? You're going to have spasm for a long time. And no matter how many times you try to pop them back in place, it's not going to help, and you're actually going to cause more and more injury. So really the best thing to do is to release the muscles of the spine, and then we can do stretches and manipulations to slide the skeleton back in the position it's supposed to be in, but pressure point release in the muscle should lead. And many times you don't really need to do much with realigning the skeleton after the muscles are all released, because it just kind of slides into where it's supposed to be. So that pretty much wraps up all the releaseology techniques for all the different things that you can do with Releasology in the upper torso. The next section is the lower torso. So thank you for watching, and we'll catch you on the flip side on the lower torso.